Good evening and welcome to another interesting package of the program Easy Access to Healthcare for All. The program brings you up to date with details and happenings around the health insurance space. The NHIS benefit package is a guideline to the healthcare services rendered to enrollees when they visit their providers. It is robust and can be accessed at different levels, the primary, secondary, and the tertiary, depending on the care needed at the point of visit. And that is what we shall be looking at in this episode of Easy Access to Healthcare for All, the NHIS benefit package and other things that help the scheme fulfill its mandate. My name is Aisha Muhammad Ahmed, your regular anchor. Do stay tuned for details after this timeout.
Easy access to quality healthcare for all. NHIS.
First on the program is a highlights of news events around the NHIS. In our lineup, Professor Nasser Sambo attends Go Health app launch. Details shortly.
Gombe State has launched its Go Health mobile application technology. This took place at a stakeholders meeting on Basic Healthcare Provision Fund (BHCPF) on March 31, 2022 at the Government House, Gombe State. Speaking at the occasion, the Executive Secretary of National Health Insurance Scheme (NHIS), Professor Mohammed Sambo, said that Go Health has benefited from 2 tranches of disbursement from the NHIS gateway of the Basic Healthcare Provision Fund, amounting to 713 million naira. Sambo said that the Basic Healthcare Provision Fund (BHCPF) was established to increase the fiscal space and overall financing to the health sector to fast-track the attainment of universal health coverage (UHC).
The program is Easy Access to Healthcare for All. As an NHIS enrollee or beneficiary, one is entitled to different services and at different levels. This service is rendered to enrollees when they visit the hospital. In our next segment, we will enlighten beneficiaries on the NHIS Comprehensive Benefit Package, exclusions and why. It will help enrollees know their rights when next they visit the hospital. Please stay with us.
Easy access to quality healthcare for all. NHIS.
The National Health Insurance Scheme was established to give Nigerians easy access to healthcare without having to worry about out-of-pocket expenses. Its main objective, amongst other things, is to ensure that every Nigerian enjoys good healthcare services. Through the years, the impact of NHIS as a scheme has been lauded because of its robust benefit packages. And the packages differ at primary, secondary and tertiary level and can be accessed at different points. We begin with the procedures before accessing these benefit package.
Normal procedure is for the enrollees to go to the hospital with their identity card or the form of identification to prove that they are being enrolled by the National Health Insurance Scheme. And so if they present that in the hospital, the NHIS would have sent the list of enrolled patients, enrolled or enrollees to the hospital previously. So the hospital will verify by looking at the list, and then the identification means that the enrollee has come with to the hospital.
The NHIS benefit package is well articulated for and catered to the needs of patients at the different levels of healthcare.
At the primary level of care, the patient is entitled, or the enrollee is entitled to the services, the normal average services that most people go to hospital to seek treatment for malaria, antenatal services, treatment for enteric fever, for upper respiratory tract infection, and for all the other uncomplicated illnesses that are treated at that level of care. And if there is a need to refer to secondary level of care, authorization code is sought from the HMO, and then the enrollee can move on to the secondary level of care. At the secondary level of care, we also have a lot of services, which includes surgeries for delivery, like the cesarean section, or surgeries for appendicectomy, and many other surgeries, prostatectomy, mastectomy for the breast, and several of the surgeries that we do. In short, the benefit package of NHIS is very comprehensive.
Having the benefit package in mind, and with it being described as robust, why then are there exclusions?
The exclusions are necessary, one, because some of these conditions are already covered under other programs of government. That's number one. Number two is that some of them may be so expensive that the program at this level of development may not be able to pay for it. Take, for example, organ transplant, kidney transplant, heart transplant, liver transplant. They are very expensive. And what the scheme may not be able to pay for it without engaging some form of innovative financing, which we are trying to build. With time, we'll be able to cover it. You have other things like before now, we had to bring a lot of innovation to begin to do partial coverage and cost sharing for some of the very expensive cancer treatment, like drugs. So we from October of last year, we started a cost sharing with policies that will bring a lot of those drugs on board.
There are other instances of exclusions.
You also have other things like maybe sports. You know, these sports, they are usually covered under some form of insurance already. You have epidemics or natural disasters where maybe thousands of people will be affected. Government has NEMA, Nigerian government has NEMA and other organizations that takes care of that. And then you have what they call workplace injuries. You have the Compensation Act that already takes care of that, NSITF and all that. So those are the few. But then there's also artificial insemination. Now we cover fertilization treatment, infertility treatment, but we don't cover artificial insemination because it is expensive. We are aware that somebody with a problem, with a case of infertility, is actually not somebody you could say is fully healthy, because when you look at the definition of healthy, it entails other things apart from physical health. And so those are the few things that we do not cover at the main time.
Dr. Agada clears the air on enrollees' complaints about delays in the issuance of referral codes at the point of accessing secondary and tertiary care.
That's a very sensitive area for the enrollees. We like the enrollees to access care as promptly as possible. And so we've had complaints of people going to hospital and not getting the authorization code on time to access secondary and tertiary care. We need to be mindful that the right thing needs to be done. The request from the healthcare facilities going to the HMO should be in a form that is understandable and that has been agreed under the scheme. The necessary information have to be there. The HMO will need to determine that these are conditions that should actually be treated as secondary and tertiary and not at the primary, to give the code. And once that is done, ideally there shouldn't be delays. But where we have delays, we are trying to get ways to get them to get enrollees to get their codes on time. And so recently, NHIS have employed medical personnel in all the state offices in the federation. And with the coming of on board of NHIS, which will be very soon, the call center system will come on board. And so we'll be able to monitor more closely, real time, what is happening over there. And at the point, NHIS may consider, overriding some of these issues and making it easy for people to go to the hospital. So where a specific time lapses and codes are not addressed, is not properly rejected, and not delivered to the hospital for the patients to access care, NHIS may have to override such decisions.
He speaks further on the misinformation on the path of some providers who say NHIS only covers malaria and typhoid fever.
The issue of the benefit package and what we cover, just like you said, is a perception that people have that NHIS covers only malaria and headache and all that, but it's not true. Most of the conditions that the average population would encounter are covered by the benefit package of NHIS. And we, just like I said, we need the help of Nigerians, not only NHIS. NHIS won't be able to do it. The journalists will have to come in. We have pamphlets now that contains the benefit package. So many things that we are doing. We also have the National Orientation Agency. They can come in and aid NHIS to talk about what NHIS covers.
Aside enrollees who have enjoyed these benefit packages, stakeholders in the scheme laud health insurance in Nigeria.
With the National Health Insurance Scheme coming on board, and with the way the scheme was being run, a lot of people, even they can access healthcare in private institutions. The package addresses most of the health needs of majority of the patients, except in very few instances like that are not covered. We are now beginning to see more of such cases. So it would be good if they can review some of the things that are in the exclusions, for instance, like this, although most of the cancer treatments are even in the tertiary institution anyway, most of them are handled in the tertiary level, but still, a lot of them are excluded from the scheme for now.
The NHIS benefit package, I think it's good because at least it covers the frequently seen cases, the cases we see often day in, day out. And it's making life, I think, easy for people. At least the coverage is kind of good, but I think it can actually be better.
Before the NHIS, I could start with the federal civil servants, and they will attest to the fact that it has been a difference. You go to the hospital, you don't have to pay, and you get your services done. You do your surgeries, your specialist consultation, and so on and so forth. The payment package has been reviewed, I think, about 3 times now, and right now I think it's very okay. So it covers almost all the illnesses, specialist consultations, and except the I would say the high-falutin illnesses. I mean, like kidney transplant, heart transplant. But it's definitely, for right now, they've included cancer treatment in it now, dialysis and all that. So I think it's okay. And of course, for the common illnesses we have, it's very okay.
I think I paid almost nothing.
It went easy. We only paid 10%.
We all work towards accelerating universal health coverage.
Everybody, irrespective of his gender, has access to basic healthcare services.
NHIS.
Welcome back from that break. The enrollee is a very important stakeholder in the entire NHIS scheme. It is safe to say that his level of satisfaction with the services provided by the NHIS is a yardstick that can be used to measure the success of the scheme. In line with our discussion on the benefit package of the NHIS, we bring you testimonies with some enrollees who have benefited from either the primary, secondary, or the tertiary levels of care under the NHIS. Grace Julius is a businesswoman who is a dependent by virtue of marriage. She tells us her experience in accessing healthcare.
Well, I've enjoyed it. I had my 3 children under the NHIS scheme, 2 boys and a girl. And each time I go to the hospital, I only pay 10% of cost of the drugs. And then in the course of the antenatal, I go there, they treat me, and I enjoy a lot of benefits under it. And then after the delivery, I go back for postnatal. My children were circumcised there. I take them back for immunization. And the only thing I get to pay is just 10% of the cost of drugs. It's been an awesome ride.
Helen Onoja is another enrollee that has enjoyed NHIS since she got enrolled. Let's hear her story.
Yes, I've enjoyed the NHIS because when I was sick, under NHIS, they attended to me. I just paid 10%. During my antenatal, when I was pregnant, the same thing. When I gave birth, still under NHIS, it was just 10%. We did not pay much. 10% of drugs and other things there.
Garba Jamilu is a public servant. He tells us the succor NHIS has brought to him.
The last time when my wife was delivered, almost everything has covered. Everything is covered. You understand? So even whenever I bring my children, like my daughter, I just bring down to the hospital. Nothing. We have not spent even a dime. I think this is just the first time that I even want to pay maybe for the drugs. You just pay the 10%. It's very, very, it's okay. Actually, for now, it's very, very okay.
Madam Felicia Zama had her 3 kids under the scheme and is still enjoying the package till date.
I'm benefit for that because I get pregnant and they operate me. As they operate me, the money that I supposed to spend, I didn't spend it like that. For me, it's a good thing for me because I benefit in it. All my children, somebody sick, I took him there and I can't spend money as I will spend for ordinary hospital bill. And truthfully, they are trying for me. I'm very happy.
Mrs. Stella Allison also tells us how both her and her husband enjoyed the NHIS benefit package at different levels.
I joined it through my husband. He worked with federal government and he added me to the scheme. Sometimes I know the drugs they gave to us, if we were buying it outside, it will cost much. But we pay little, just 10% of it. Then they will give you all your drugs. And like I goes to check up, I have been referred to Telish and I did check up. I was not charged much. So they have been attending to me. Any issue that comes up, I come to them, they attend to me, but I just pay a little of it. My husband, as I told you, that go through the surgery here and 44 also. We referred to 44 from here. So, and we did not pay for the surgery. We only, even the drugs we were using, it's only that 10% we paid.
Linda Ahigbe, another public servant, says as an enrollee, she has enjoyed some services that has brought ease to her and her family.
I was enrolled by my organization and I used Custom General Hospital Caro. I've used the scheme since 2010. I had my 4 children through the scheme. I was only paying 10% of what was the total amount. And apart from childbirth and antenatal, I've also used it generally for whenever any of the family member falls ill. It's quite encouraging and nice. You know, as soon as you get to the hospital, when you say NHIS patient, they say go this way, and gives you the privilege, like feeling very important, and you work and they attend to you quickly and as possible.
There are more of such stories of enrollees who have enjoyed the services of the scheme, and that is what the NHIS is all about. For now, let's take your questions answered. Do stay tuned.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled?
How can I get enrolled?
Question: what is the giftship program?
It is supposed to be an all-encompassing program that will cover G group of people, I individual, and F family, who are not employed within the formal sector, but they are either employees of the informal sector or they are self-employed, provided they are earning salaries, they are earning income, and that income is sufficient enough to pay premium and get into the social health insurance ecosystem.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled?
How can I get enrolled?
I think I paid almost nothing.
It went easy. We only paid 10%.
We all work towards accelerating universal health coverage.
Everybody, irrespective of his gender, has access to basic healthcare services.
NHIS.
On that note, we end this episode of Easy Access to Healthcare for All. If you are not a government enrollee registered on the NHIS platform, take advantage of the giftship product of the scheme and get you and your family enrolled to also enjoy the health benefit packages. It's one sure way to avoid out-of-pocket expenses for healthcare and to give yourself peace of mind. See you next week.